Hey everybody, welcome to my channel. Today I am Dr. Perkins, a board certified OBGYN, and today we're talking about what do you do if you have gestational diabetes. So in this video, we'll be talking about what is gestational diabetes, how to best manage gestational diabetes, which I may refer to as GDM as we continue to talk about this, exactly how to modify your diet and how to exercise and move for GDM. We'll talk about medications, baby monitoring, and when to expect to have your baby delivered if you have GDM. We're going to talk about so much good information today, so I hope you stay with us as we dive into gestational diabetes, which is such a very important aspect of possible prenatal care, prenatal journeys, as well as they can influence how you feel, how your delivery goes, as well as your postpartum life. So let's talk so much more about this. Gestational diabetes is diabetes that develops during pregnancy, which is a complete, almost like an episode of diabetes in your life that is very different from who you are as a normal person. What do I mean by that? Once your pregnancy clears, if you have GDM or gestational diabetes, you're no longer a diabetic. Before the pregnancy started, you were probably not a diabetic. Gestational diabetes is something that develops in your body specifically due to pregnancy between the gestational age of 20 weeks and 40 weeks of pregnancy. This is a problem that develops because of the placenta. The placenta inhibits your body's ability to respond to insulin that's being produced by your pancreas. So what does that actually really mean? Think of this. You have a meal and say you have a slice of pizza. The pizza has carbohydrates in the crust. It has fats from the cheese. If you added a little bit of protein on there like pepperoni, now you have protein in your meal. And so in general, you have three main categories of macronutrients in the same meal, which is wonderful. So you eat this slice of pizza, the food goes into your stomach will break it down into smaller pieces and sends the result of the breakdown to your liver. Your liver then does a very important job in making sure that this is healthy and safe for your body. If it isn't, it will send it back to the colon for it to be excreted. If it is, it will pass the test, and then this will be released into your bloodstream. Your blood then has the responsibility to move all of these nutrients, the fats, the proteins, all of the carbohydrates that you just ate, and to ship and package all of them to your organs. So your blood will go and do a drop off to your brain and say, hey, this is your package. You have all three. Here, the lungs will come along and they'll get their package as well, and the kidneys and your muscles and your joints, everything will get a package of protein, carbs, and fats from your meals. This is in a normal circumstance. If you have gestational diabetes, your body and your organs are not able to receive the carbohydrate parts of your diet, meaning the crust of the pizza. Your body is not able to use that. And so instead what happens is that the carbohydrates are broken down and known as sugar in the body will remain in the blood in circulation around and around because the organs cannot respond to insulin to use the carbohydrates. So it builds up. In pregnancy, this is a problem because when your baby gets that same blood flow, your baby says, hey, we have sugars and carbohydrates, we're happy. And there is actually no regulation in your baby's system to only receive a certain amount of carbohydrates. And so what happens is that a majority of those carbs will be deposited in your baby's system. And this is actually not a good thing. It is not a good thing because your baby can be overwhelmed by all the additional sugars that are being deposited into its system, forcing its own pancreas to overproduce insulin, trying to fight and contain all of the sugars. It then leads to your baby gaining bigger, a lot more body fat than the typical average baby, because all those sugars are being stored as fat in your baby's body. And what can happen over time in pregnancy, babies can lose in this battle trying to reduce the amount of sugars that are being shipped to its system. And this can lead to stillbirths. stress. It's one of the most devastating things if it happens, but the scariest part of gestational diabetes. Because you may not feel symptoms, you may not have an issue. Really, you can live your life feeling completely normal with the gestational diabetes. But the person who suffers is your baby. And so it's very important that once you get this diagnosis, that you start to implement changes in your life to decrease the amount of glucose or carbohydrates that you're intaking so that your excess sugars and carbohydrates are not being shipped to your baby's system. And so how do you do that? Well, you will now be required to check the amount of glucose and sugars that are hanging around in your blood 4 times a day. So that means that you're taking your sugars first thing in the morning before you eat. That's your fasting sugar level. You'll then either take your sugars after the start of a meal. So the start of you eating breakfast, the start of you having lunch, the start of you having dinner. You'll check those blood sugar levels or glucose levels. You have 2 options as far as when to check. You can either check 1 hour after you started eating or 2 hours after you started eating. There's no right or wrong. The important thing is that you kind of stick to one of them. On average, most people will check 2 hours after the start of their meal. With that, you want your sugar levels to be in range on a regular basis. Like, you don't want them to be too high. And so what are those numbers? Well, for fasting first thing in the morning, you want your sugars to be under 95. For 1 hour after the start of your meal, we want your sugars to be under 140. 2 hours after the start of your meal, we want your sugars to be, or your glucose levels to be under 120. If you're able to maintain and have your glucose levels be exactly where they need to be, then the worry about gestational diabetes and stillbirths with your baby and your baby having a hard time actually gets reduced, and your risk actually gets very close to what would be normal for any other pregnancy. If you struggle with being able to make changes to your diet appropriately or to keep your glucose levels in normal range, then we may consider adding medications to help to reduce those levels so that your baby is protected. Now, those medications can look like insulin, it could be metformin, it could be glyburide. This is something that your healthcare provider will discuss with you, in addition to helping you with a nutritionist and a dietitian if necessary, to help you make those changes as needed. Now, your diet changes really will focus on carbohydrates. There are good carbohydrates and bad carbohydrates. Good carbohydrates are those that are whole grain, such as 100% wheat. So if you think of a slice of bread and you have whole wheat bread, 100%, that is a good carbohydrate to have, compared to white bread, which has no grains. And so the difference between the two is that when you eat white bread and you're gestational diabetic, your sugar levels will spike very quickly within 15 to 30 minutes of eating. And all that spike with those extra sugar levels gets dumped to your baby. Compared to whole wheat bread, which will slowly increase those blood sugars, will not cause the blood sugars to be higher than they need to be. Therefore, no excess sugars are being sent to your baby, which is the ideal situation and what you want to do. And so your nutritionist and your doctors will help you to make adjustments so that you're only incorporating healthy and better carbohydrates so you can prevent having those spikes in sugars that will be a spike for your baby's system. In addition to that, it'll be very important that you incorporate exercise if you're not already doing so. And sometimes that means maybe going for a walk before or after your meal. Why? Exercise allows your muscles to use excess carbohydrates and sugars that are just hanging around in your blood. So it's another method to help to reduce those levels so that all those sugars are not being submitted to your baby. If you're able to keep your sugars within range, which is a wonderful thing, and many gestational diabetics can do this just fine, you'll be able to continue in the pregnancy all the way until the end of pregnancy. And the hopes would be that you deliver before 41 weeks gestation. If for some reason you're on insulin or some kind of medication but well controlled, we may want your baby to be delivered a week early, so somewhere between 39 and 40 weeks of pregnancy. If your sugars are uncontrolled and it's just difficult for it to be in the normal range, we may want you to be delivered as early as 37 to 38 weeks of pregnancy. It is not unusual that if your levels are really chaotic and your baby is at risk, we may even suggest or recommend delivery in the preterm state, 35 weeks, 36 weeks, 34 weeks, depending on what the risk factors are for your baby. Now, having gestational diabetes is not the end of the world. It is not a great diagnosis, but it's something that can be well controlled by just making changes changes to your life. That means you being committed just for another 10 to 12 weeks to make sure that your levels of your glucose and carbohydrates are not too high. You can have a healthy and safe baby and delivery. I hope this all makes sense, and guess what? I have something more that I'd like to add for you today. I'm offering you a free copy of my ebook, Hormones Don't Lie. In this, we'll be able to talk about our bodies as females, how to make adjustments to create balance. The more balanced we are, the more that we're able to reduce the likelihood of so many different things happening to our system. And so we want you to be in your best state. I want you to be in your best state. And so I'm offering this to you today. If you'd like a free copy of this ebook, go ahead and click the link below and I'll be happy to share it with you. Thanks for being here. I'm Dr. Perkins. We talk about this and so much more. Really, questions that you have on a regular basis right here on my channel. Thank you for stopping in, and I hope to see you next time.